Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter I. Still, I'm going to talk about the inflammation. I think I had another stream of video talk about inflammation, which emphasize on the mechanism, fundamental, basic medical knowledge. But today, this information will be clinic oriented. I'll talk about the diseases associated with this inflammation. So let me just bring up first the emergency situation. Any emergency situation associated with this inflammation really depends on the causes. Some of the inflammation are the chronic or long-term diseases. So if that's the case, it doesn't need the emergency attention. But if the process of the inflammation caused by the ischemic, for example, the myocardial infarction, or the stroke in the brain, actually the fundamental pathological changes after this cut of the blood supply is undergoing this, the inflammation. It depends whether the tissue can be regenerated or repaired. Otherwise, it just cause the significant pathological consequences. So if that's the case, like a stroke or myocardial infarction, of course, that's the emergency situation with this actually under the mask of the inflammation. So that's the case. You have to go to the emergency room to save lives. So basically, any other of the inflammation conditions that you can manage at home, actually you probably do it a lot of time, many times, almost not on a daily basis, but in daily life, we battling this we have this inflammation process all the time, actually going on in the body. So sometimes maybe you know it, sometimes you do not know it, but it's a keep going process. Probably you have managed at home. But if the chronic inflammatory diseases, either internal organ or the joint or the connective tissue, so that is the really pathological conditions, has to be managed by the physician under the guidance of professionals, so that can treat and help to battle this kind of consequences or complications by the inflammation. So let me just briefly review the inflammation process. What is the inflammation? Inflammation actually is a defense mechanism. However, this is limited primary defense mechanism. The body undergoing process from the damage of the blood vessel, the inflammatory cells leaking out of the blood vessel, secreting out chemicals to battle at local area, to battle the whatever the pathological causes, either bacteria or viral invasion, or the cells undergoing necrosis. So this is the normal actual defense mechanism. However, there's limitations, and also there are overreactings. So regardless, this inflammation can cause many diseases, actually, such as autoimmune diseases, or the injury, or the bacteria or viral infection, or the cancers, or the subtle precancerous conditions. They all start with this kind of process. So it's kind of complicated. We heard inflammation all the time. So I'll give you an example. The inflammatory diseases, like the rheumatoid arthritis, basically it's the inflammation of the joints caused by the autoimmune factors, autoimmune reason, the overreacting. So the inflammatory cells out of the blood vessels to the local area secrete the chemicals. So those chemicals not only to defend the body, but also can cause the damage. So that is the side or reaction of the inflammation. The original goal of the inflammation was good to heal, but there always some other overreacting. The cells, like I said, produce different kind of chemicals, different antibodies, so that cause the local reaction. So one of the example is the the inflammation disease, inflammatory disease, I already mentioned rheumatoid arthritis. Like the other, a group of the inflammatory bowel diseases is also caused by the autoimmune, which really is overreacting of the inflammation. Like I mentioned, inflammation, for example, your local area, either insect bite or you cut at the skin, that inflammation reaction which served a good purpose to the inflammatory cells come out to the local site to lay out the fibers, to seal, and also the stem cells to regenerate, to recover. However, there's some people during this healing process can also have the overreacting of inflammation, causing the scar which is unhealed all the time, overproduct of the fibers or from the fibroblast cells. So this inflammation causes the inflammatory bowel disease, serve the same idea. It's autoimmune caused either Crohn's or ulcerative colonitis. So these are the inflammation, the clinical significance, serving as defense at the same time cause the damages. There are a lot of diseases really from the overreacting of this inflammation process. So having said that, what are the clinical presentations for those overreacted inflammation? For example, rheumatoid arthritis. You probably know the small joint, symmetrical, and morning stiffness, lasts longer, and kind of here there, not fixed in one joint or two joints, just sometimes here, sometimes there. Those people usually those kind of disease usually tend to occur with the genetic predisposing factors, and also the female, particularly beyond 40 years old, or sometimes can be earlier. And this kind of inflammatory diseases on the joint. So the management, of course, first of all, diagnosis, testing the blood to identify the rheumatoid arthritis factors, and other markers to identify, to diagnose, and then treat it, to quench or to tapering down this inflammation, so then can recover, can feel better. The same idea for the other inflammatory bowel disease also has to be diagnosed, sometimes has to undergo in the scope to look at inside of the intestine wall, whether there is some cobblestone presentation or the ulcers, and then take a tissue to biopsy, look at the inflammatory cells under the microscope. So these are the, of course, treatment, the same idea, to quench that inflammation, to seal the mucous membrane, to feel better. Those are the fundamental basic at the mild stage. Later stage, of course, they're either surgical or other medications, autoimmune medications to treat it. So this is to give you some idea about the inflammation and clinical oriented conditions. Everything good, and if overdue, can generate this kind of side effect of this inflammation process. Anyway, this is I hope this video can give you some idea about those conditions, and also a little touch on the defense mechanism of inflammation. If you are interested, you can follow my other stream. I think I have talked about the inflammation process. So I'm going to stop here today, and thank you for watching. I will see you next time.